Fight against obesity. What is obesity? Obesity is a complex, chronic disease with several causes that lead to excessive body fat and sometimes poor health. Body fat itself is not a disease, of course, but they may impair health. But when your body has too much extra fat, it can change the way it functions. These changes are progressive, can worsen over time, and they can lead to adverse health effects. So, when did body fat become problematic? When there is too much body fat, insulin doesn't work as well as getting glucose, the body's main source of energy, into cells. A couple pounds of extra body fat usually doesn't cause problem for most people. But when people keep up a pattern of eating more calories than they burn, more and more fat builds up in their bodies. Despite being a preventable disease, the prevalence of obesity is rising progressively worldwide. In Malaysia, many studies have reported prevalence of obesity among adults. According to the World Population Review 2019, Malaysia has the highest prevalence of obesity among adults in Southeast Asia at 50.6%, followed by Brunei 40.1%, Thailand 10.0%, and Indonesia 6.9%. The data also revealed that the overweight and obesity levels were particularly high among women 54.7%, and those in the 55 to 59 age group is 60.9%. This is all the example of article newspaper about obesity cases in Malaysia. What are the risks that can be followed by obesity? Obesity risks heart attack, diabetes, and stroke. Heart attack, excess weight can lead to fatty material building up in your arteries, the blood vessels that carry blood to your organs, and if the arteries that carry blood to your heart get damaged and clogged, it can lead to a heart attack. Diabetes. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Hypoglycemia, also called raised blood sugar, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body systems, especially the nerves and blood vessels. Stroke. A stroke, sometimes called a brain attack, occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. A stroke can cause lasting brain damage, long-term disability, or even death. This newspaper article an example of obesity risks that are reported in Malaysia.
So, what are the solutions for us to fight against obesity? Just to let you know, obesity can happen for a number of reasons, including diet, a sedentary lifestyle, genetic factors, a health condition, or the use of certain medications. A number of treatment options can help people to achieve maintaining a suitable weight. Sometimes, a health condition such as a hormonal problem can result in weight gain. In this case, treating the imbalance can help to solve the problem. One of the solutions is involving the physical activities. It's a good way to start getting active by walk briskly, swimming, and frequently use stairs. Obesity can impact both your physical health and mental health. You may be unsure of where to begin, but achieving and maintaining a healthier lifestyle is a good start. Thank you for listening.